Hello, everyone. Welcome to today's episode of the Recruit podcast. For those of you just joining us, we're Dwerk. We specialize in helping recruitment businesses scale their revenue over the next 12 months. If you learn how to take your recruitment business to the next level, make sure you stick around for this amazing conversation. Today, we have Dr. Vincent Roddy. Vincent, do you want to introduce yourself?
Dr. Vincent Roddy, founder and CEO of Synergy Medical Collective. I am a board-certified emergency medicine physician, practicing and running my business out of Miami, Florida, USA.
Amazing, amazing. Well, Vincent, we'll get straight into it. You mentioned your company there, SMC, that you recently started. You founded and are the CEO. Can you give me a bit of a quick overview on the company and what it does?
Yes, Synergy Medical Collective is a healthcare staffing and consulting firm, like I said, based here in Miami, Florida. The company was founded actually January 2023. We were very fortunate to find our first hospital-based client in April 2023, and we've been in service to them since then. We do have a few clients out of state in which we provide healthcare staffing resources for them as well. And that's essentially what it is. I mean, we're coming up on we'll be 4 years in January 2027. I should just give a general overview of what the company actually does. As I said before, we are a healthcare staffing and consulting firm. What that means is that we make relationships with client hospitals to bring them the staffing resources they need to staff their emergency departments. The way that it works here in the United States is that companies own hospitals, and companies can choose to either directly employ the physicians, nurses, techs, and other staff that work in the hospital, directly employing them, or they can choose to utilize a staffing vendor to do certain things, certain services within the hospital. This is no different than hiring a cafeteria vendor to run your cafeteria or to serve lunch, or to hire a security firm to be your security, vendor for the hospital. The client that we have and the clients that we're looking for are people that do not want to run the emergency department physician services in the hospital. They would then contract that to us, where we have the exclusive contractual relationship to provide board certified physicians. We do the billing and collection for the physician services that are provided to the patients from the emergency department. It's a teaching facility, so we teach medical students and residents. We consult with the hospital on revenue cycle management services to help their processes be more efficient, less expensive. We do community and EMS outreach to let the community know that we're there to serve, and to let EMS know the types of services that we provide so that they can bring us patients that can benefit from what we do. And as I said before, we have relationships with client hospitals out of state, in which we lease physician staffing resources to them for short-term opportunities, usually at a premium, because the provider is required to travel. So in short, that is what Synergy Medical Collective does. We've been very successful at that. We have a couple of case studies on our website, synergymedicalcollective.com, that you can read to actually see how we've been able to provide these services and to get results for our clients. And I'm happy to discuss this with you. And if there's other hospitals or hospital systems that are out there looking for the best emergency medicine staffing services available, particularly in the Miami area, you know where to find us. Here at Synergy Medical Collective.
Oh, fantastic, fantastic. Now it seems a great thing that you're doing, and seems like you're sort of in a couple of different avenues. I suppose before we dive a bit deeper into SMC, can you give us a quick overview of your journey from an emergency physician to now a founder and CEO of this firm?
It's a crazy story, my friend. It's a crazy story. I just literally went to a wedding this past weekend. So I was talking to a friend of mine that encouraged me at a time in which I needed encouragement, and kind of helped me stay on the path that I ultimately have been on, and got me to this point. In short, I went to college in the United States. I'm a Duke University graduate. I went to medical school in Virginia Commonwealth University School of Medicine. You all I think you're based in the UK. So for your watchers, Virginia is the first U.S. colony that was, settled by the British. So that's, part of our claim to fame. Went to medical school there, did my residency in emergency medicine, a 4-year emergency medicine residency in New York City. In terms of the patient population, the types of cases that you saw, and the quality of education for emergency medicine, there was no place better for me to work than New York City, 2009 to 2013. So did all of those things. I mean, that's how you would become a professional emergency physician here in the United States. College, medical school, residency. Once I finished that, I moved to South Florida, where I've been for the last 13 years. I was fortunate enough to get a job at a level 1 trauma center in Fort Lauderdale. It's roughly 20 miles north of Miami. And I worked there for 5.5 years. And that was the first experience that I had that kind of informed what I would later do. I say that because it was a challenging job. You had to work very hard, and we have very sick patients. And after having worked there for 3.5 years, I was fortunate enough to become the assistant medical director for this emergency department. This was relevant because it allowed me to take more of an administrative role while I still saw patients. And, I recently told a friend of mine who's also looks like he's going to get a promotion at one of his jobs. The second that you become an assistant medical director of an emergency department, usually companies start reaching out to you to become a medical director. So it's funny. I mean, I didn't anticipate leaving that job, but after having been assistant medical director for about a year and a half and just looking at the trajectory and the opportunities that may or may not have been available there, I got recruited by another company to become their medical director of their emergency department. So, at this point, I'm in probably my mid 30s, a little older now, but, mid 30s. And 2019 was my first year as a medical director of an emergency department. I was a medical director of a hospital here in Miami. We had an amazing team. The place had several low-hanging fruit that could be corrected that would hopefully supercharge performance and efficiency. We led a process improvement initiative in 2019. I was able to design that with the team there. It cost the hospital absolutely no money. By merely reorganizing the chess pieces on the board, we were able to increase efficiency, decrease loss, serve more patients, provide a higher quality of service. And then at the end of the year, they came out from Dallas because that's where the company was based out of. And they told us that we somehow had made them $3 million additional dollars against their budget, which, that was not initially the goal of what we were doing. The goal was just to help people. But that was when it's kind of like a light bulb moment that, okay, this is something that I can do. I mean, like the truth is the performance. So subsequently in 2020, I went to business school. I was fortunate enough to go to business school and get my MBA here in the United States, an executive MBA. So I worked as an emergency medicine physician, medical director. Now we're during the pandemic leading this team while also in school. And, the Duke University Fuqua School of Business experience was life-changing for me because, Duke didn't specifically teach me how to start a company or to offer a differentiated service to the healthcare market. What it did do was it opened my eyes to the possibilities of what business done right could do for patients and healthcare workers. And ultimately we came to an impasse with the job that I was at, because when I was in business school, I was learning all these things and I was telling them, I was sharing it with them, my supervisors. And I think that the appetite for that, some people might've been interested in hearing it. Some people probably weren't. And, ultimately we separated once I finished business school, and it was surprising in the way that it happened, but I truly believe that everything happens for a reason and that God's timing is perfect. And, the whole purpose of my company, Synergy Medical Collective, is that we are a service organization, service to the healthcare workers of America, first and foremost, service to the patients, service to the clients that we would serve. I would say service to the healthcare workers first and foremost, because you have to take care of the very people that you're asking to do the work, so that they can be comfortable and then thus take care of the patients. If you focus on actually helping the staff and supporting the healthcare workers of America, there's no question that the work as it relates to helping patients, serving patients at the highest level will get done. And I know this because I myself am a healthcare worker, and I saw that this was probably not being prioritized during the pandemic. And I wanted to found an organization that codified the support of healthcare workers first, so that we could then help the patients subsequently. And that is what Synergy Medical Collective is based on. That's actually our motto: supporting patients and healthcare workers across America. It's what we do. It's what informs every decision of what we make here. And again, we've been very fortunate to be with our client for 3.5 years, coming up on 4. We've been very fortunate to have made relationships out of state. So it's a multi-state organization at this point. And the most fun I've ever had in my life. That's how I know that we're on the right path and that we're acting in a way that is consistent with our values. That's pretty much what it is.
Yeah, that's amazing. It sounds like a very amazing journey, as you mentioned. Just quickly there, you mentioned sort of the foundations that SMC is built on. It sounds like justice, fair play, fair pay, and teamwork, and it sounds like very much a people first organization. And I suppose your model, which is physician led, I believe, how does that, in your opinion, compare with the traditional healthcare staffing model?
It's funny. I mean, the issue with the current healthcare staffing models is that, how would I describe this? I'm trying to be polite with it. They're not necessarily physician led. The general consensus is that people believe that profits are being put over patients. which means that, physicians are being put in positions that are uncomfortable to them, that they may not have the staffing support that they need to safely help people. This, contributes to burnout. This contributes to, physicians maybe feeling overwhelmed with the situation. And, then we're working in a scenario where you're really never allowed to make mistakes. And I say this to my physicians, what percentage of heart attacks are you allowed to misdiagnose? I mean, what percentage of strokes are you allowed to misdiagnose? The answer is 0. I mean, you're expected to be, perfect more or less in your performance. Some people would say that that's not fair, or that, this is why people might order more tests, than maybe is necessary. But when you're in that scenario, how do you justify that to a family? Misdiagnosing someone, or somebody having a bad outcome. Sometimes good medicine can lead to bad outcomes, but that's like a whole nother story. I mean, people don't seem to understand that. So long story short, I didn't feel that the physicians were being served at the highest level. I'll give you an example. I mean, the whole premise of my company actually was, can be traced to a paper I wrote when I was actually in business school. We were taking the whole thesis of it. We were taking operations management. We were taking managerial accounting. And I literally saw this play out in real time. Essentially what happened is that during the pandemic, the stay-at-home orders got put into place. And when the stay-at-home orders got put into place, people stopped coming to the hospital for essentially people stopped coming to the hospital. Like if you were a pregnant woman and you were bleeding, or if you had bad back pain, or if you had a bad headache or something like that, these things kind of stopped coming to the ER. That were usual cases that we would see. And so what happened from a business standpoint is that if you have a business that is used to serving 150 clients per day, paying customers per day, and you have a staffing model that is based on 150 patients showing up to your ER per day, and the stay-at-home orders get put into effect, and then suddenly patient volumes go from 150 to 70, just like that, which is what happened. The companies that controlled, that were the larger companies, I should say, that are private equity backed, instead of keeping the physician staffing resources in place that would service 150 patients per day, because remember, physicians are usually paid hourly, or they have a salary or something like that. What they did is they actually decreased the number of staffing hours that were on the schedule to go from 150 patients per day to 70 patients per day. That makes sense because you have less revenue coming in. What that ultimately did, however, was that it caused a pay decrease, a massive pay decrease for the medical staff at the hospitals at the very time that they were being asked to sacrifice themselves and be selfless and to be the frontline providers for a once in a lifetime, healthcare emergency. And so, because the prices of things didn't decrease, right? Your rent doesn't decrease, your mortgage doesn't decrease, the cost of food and education in this country has not decreased. The healthcare workers of America got a pay decrease. And so this, a pay cut at a time in which, our services were the most needed ever. And, this didn't sit well with people, and people began to look at the actual structure of these companies. Oh man, who's actually running them, and why were these pay cuts needed, and all these types of things. And ultimately they realized that they were tied to private equity backed banks, essentially, that had bought smaller companies throughout, the last 10 or 20 years and consolidated them into larger companies. And by doing so, they control large swaths of emergency departments across the United States. They also control all the money that is made at those sites. And if they decide that they want to pay the physicians less money or pay the staff less money to maintain their profit margins, they can do so. And so people were probably okay with that relationship, from the late 90s to the 2010s, maybe even into the early 2020s. But during the pandemic, it's come to a boiling point where people have really gotten dissatisfied with that model of work because they don't feel like they have any say in how the site is run. All of the money that is generated from the services that are provided by the physicians are not actually owned by the physicians. They're owned by companies that do not have, out-of-state, non-local leadership. And when the leadership is not local and the leadership is consolidated somewhere far away, how do you actually get your grievances or concerns heard to make things more fair and equitable for you to continue working and taking care of patients? People should understand that it's very difficult to become a physician in this country. It takes years and years and years and years and years of work and sacrifice. It's obviously a delayed gratification type profession that physicians, the vast majority of them, do not become doctors because they want to make a lot of money. They become doctors out of the desire to serve people. But if you're going to ask people to go to school for, 12 to 15 years, if you're going to ask people to take out hundreds of thousands of dollars in loans to finance education because it's not public in this country. It's something you have to pay for. If you're going to ask people to show up to work during a once in a lifetime pandemic in which elective surgeries were canceled, urgent care centers were closed, many other support staff, nurses, techs, whomever else that weren't considered absolutely vital to the infrastructure of the healthcare system were allowed to call off and not come to work and or retire in some cases, because many people retired early because they didn't want to deal with that stress. And you expect the physicians and the nurses and the staff in the emergency department to still show up and essentially support the healthcare infrastructure of America. There has to be some type of agreement in place that is satisfying to both parties. And like I said before, to cut somebody's pay almost half during that time, during a time in which the prices of things have not decreased, is not something that's going to go over well. That agreement didn't sit well with people. So essentially, what makes SMC really different, in addition to the fact that we have the best physicians, best services, we do all procedures on demand for the patients, et cetera, is just the founding principle of justice, fair pay, and teamwork. Justice in the way that we treat the physicians. If you have a grievance or some type of issue, you can come and speak to me about it and speak to us about it. And we're going to try every avenue available to resolve that in the way that is respectful to both parties. Fair pay, in the sense that, again, we're not private equity backed. We do not have external funding. The money that we make is directly used to fund staff wages at a time in which other people are finding ways to pay you less money in an inflationary environment. I have made the commitment to take the money that we have directly reinvested into staff wages, and when we have profits, directly reinvest those profits into staff wages. If you believe that owning a stock and being paid a dividend means you have equity in the company, this is no different. This actually gives the physicians skin in the game and makes them feel, respected for the contributions they make to the overall success of the company. And then obviously teamwork. We rely on one another. It's a non-toxic environment. We have recruited a lot of very nice personalities that actually want to be there to help the patients and to help the site be successful. So in those ways, we're different. We would never take private equity money. It's not about, me making money, as the owner of the company. It's about service to the healthcare workers of America so that we can serve our patients. I believe if more people knew about our solution and what we were offering, we would be more, it would be easier to scale the solution. And, that's another one of our catchphrases is I choose SMC. When the physicians join the company, they give me a statement explaining why they chose SMC. I'm not forcing anyone to do anything. This is voluntary. I remind you, you chose to be here. You have made commitments to the company. I'm here to serve you. I've made commitments to you. And if we do that together, serving one another while serving the patients, I think that the success that we want is just a matter of time.
Yeah, no, I think that's fantastic. I think that's a great philosophy to have. I suppose from your perspective, how much has working on the front line and your background, how much has that affected the way you lead people now as the CEO?
It has affected me. I think, in the United States, most healthcare organizations are not run by people that have ever, taken the Hippocratic Oath or ever, helped a patient at the bedside, doctor, nurse, tech, respiratory therapist, whomever. And frankly, you just can't really understand the job in the way that someone who has been doing the job or trained to do the job, can't understand it. Fortunately, I've been lucky to work with partners that are open to our feedback and open to the suggestions that we have for them. But, to answer your question, how has being a physician made me more, affected me as a CEO? It's made me more empathetic. It's made me more empathetic. It's made me more patient. The doctors are allowed to practice medicine in the way in which they feel is best for the patients. You do not necessarily have to do what Dr. Vincent Roddy would do. You're allowed to be the doctor that you are because I believe in you and I hired you to join our team. We're the best team in Miami. And so, if there is an issue or misunderstanding with a consultant or a nurse or one of the referring partners that sends us patients, having been in that seat, I'm always empathetic to the physician. And, I'm not somebody that's going to jump to conclusions. I'm going to support my physicians. And of course, we're going to do it in a way that still supports the clients that we have.
Yeah, fantastic. I think if we talk about sort of SMC, you've come a long way from 23 when you started to where you are now. It seems like a great journey. Where do you plan, or as the leader of the company, where do you see the company in the next 12 to 24 months? And I suppose what are some goals that you would want to achieve?
Where will we be in the next 12 to 24 months? Exactly where we are now. serving the client that we have, because that's one thing. I mean, you want business growth, and you want business growth, of course, and you want to gain new clients, but that cannot be at the expense of the clients that you currently have. You have to continue to serve them to the highest level. So that's number one, continuing to serve our client at the highest level and making sure that they're happy with the services that we provide. There's a number of area hospitals in around us, even around the state of Florida or even out of state. We just need one other person to choose SMC. We just need one other healthcare hospital system to choose SMC, because once that happens, it's gonna be out of control. I mean, it's gonna be amazing. One business partner, one client can change your life. And again, this is not about how can we win. It's about how can we support our clients winning. And so I really do believe that will happen. I mean, I'm out here meeting and greeting and going to business events, and people in the area definitely know where we are. If anybody's watching and you're curious, I mean, listen, it's hard to get these contracts. It's very difficult. These sometimes are multi-year agreements that you're inquiring about. The current partner may have been there for many, many years, and it's a multi-year agreement that's not even up for bid. And then when they do come up for bid, how do you actually get to be inside of that room where you're one of the persons that get considered? And so, that has been an experience learning about that and learning that process. I don't want to, show our hand too much, but at some point we will utilize, emerging technologies to supercharge what we're doing. And so I think that, when we're finally at a point where we can do that, then that will also be something that drives growth and again, will be in alignment with our mission of supporting patients and healthcare workers.
Yeah, fantastic. I think it really shows, how far you've come, and, from my perspective, it seems like an amazing journey. And from my perspective, it's been an absolutely brilliant conversation, and those insights that you've provided